Ever wondered why some menstrual symptoms seem more severe than the usual? Every woman's experience with menstruation is unique, and so are the symptoms. However, when these symptoms seem to be more intense or disruptive, it may be a sign of something more serious. From dizziness to severe migraines, these symptoms could be indicating conditions such as endometriosis or PCOS. In this video, we will look into 6 period symptoms that are not normal and what they could potentially mean. First off, experiencing dizziness or even passing out during your period is not normal. It's crucial to understand that these symptoms could be indicative of severe blood loss or anemia. Now, anemia occurs when your body's iron stores run low, often due to substantial blood loss. This, in turn, can cause inadequate oxygen supply to your brain, leading to dizziness, and in extreme cases, fainting. It's also worth noting that these symptoms could be related to other health conditions such as endometriosis or polycystic ovary syndrome, also known as PCOS. Both of these conditions can affect your menstrual cycle and overall health in significant ways. Regardless of the cause, it's vital to consult with a healthcare professional if you're experiencing dizziness or fainting spells during your period. They can provide an accurate diagnosis and the appropriate treatment options for your specific situation. Remember, fainting during your period is not something to brush off. Next, we'll look into heavy periods, characterized by bleeding that totals more than 80 milliliters. This is not your typical bad day. It's a symptom that should warrant immediate attention. Heavy periods can be indicative of critical health issues like endometriosis or PCOS. Endometriosis is a condition where tissue similar to the lining of the uterus is found outside the uterus, leading to significant discomfort. PCOS is a hormonal disorder resulting in enlarged ovaries with small cysts on the outer edges. Interestingly, lower back pain can also be a symptom associated with these conditions. This pain usually feels like a dull ache that intensifies during your menstrual cycle. If you experience this in combination with heavy periods or other symptoms, it's all the more reason to seek medical help. But how do I discern if my period is heavy? You might be wondering. Well, it's vital to keep track of your menstrual flow. If you're changing your pad or tampon every hour for several consecutive hours, or if your period extends beyond a week, it can be considered heavy. Remember, a heavy period, especially when accompanied by lower back pain, is not just an inconvenience. It could be a sign of an underlying health condition. Cramps that disrupt your daily activities are another symptom to take seriously. Now, a certain degree of discomfort is normal during your period, but when cramps become severe, it could be a sign that something is wrong. Some of these concerns can include fibroids, PCOS, or endometriosis. Fibroids are non-cancerous growths in the uterus that can cause intense pain and heavy bleeding. It's important to note that severe pain is not a normal part of the period experience. We've somehow normalized the idea that excruciating menstrual pain is something to be endured, but it's not. It's a signal from your body that something might be off. So, if you're dealing with severe cramps, it's crucial to consult a healthcare provider. Another symptom is experiencing nausea or vomiting during your period. It's not uncommon to feel a little queasy, but if it's severe enough to make you throw up, it's worth talking to your healthcare provider about. Apart from the problems that have already been mentioned, another potential culprit could be hormonal imbalances. Your body's natural ebb and flow of hormones throughout your menstrual cycle can sometimes get out of whack, leading to a host of unpleasant symptoms. This is why it's so important to track these symptoms over time. By doing so, you can help your healthcare provider pinpoint potential patterns and clues that could lead to a diagnosis. Remember, your period should not be a monthly ordeal of suffering. Lastly, sudden and severe headaches or migraines during your period are not usual symptoms. These are often the result of hormonal imbalances or menstrual migraines, a condition characterized by headaches that occur in a pattern related to the menstrual cycle. While many women experience mild to moderate headaches during their periods, severe or sudden headaches are not typical and should be taken seriously. These headaches might be accompanied by sensitivity to light or sound, nausea, and visual disturbances like flashing lights or blind spots. They can be so intense that they disrupt your daily activities, and that's a sign that it's more than just a typical headache. It's important not to dismiss these symptoms as just part of your period. So, we've covered 6 period symptoms that are not normal and what they could potentially mean. The key takeaway here is, these symptoms are not just part of being a woman. They could signal serious health issues. If you're experiencing any of these symptoms regularly, it's crucial to seek medical advice. Your health is important. Don't brush off these symptoms. Stay informed. Thank you for watching. Don't forget to like and subscribe. And feel free to leave any questions or previous experiences in the comments below. See you all next time.